Any questions or comments from the audience on what you just heard, or indeed what you haven't heard?
I'm also sort of involved in trying to design that, and we've got this real struggle between when you're asking people and you're gathering user opinion, how much sort of weight do you put on what they're saying they would want when you don't know how much they understand about what would change their behaviour, and then how much weight do you put on intervention functions, especially when sometimes the evidence, even with systematic reviewing, the evidence isn't there for behaviour change techniques which to use. Just wondering how you sort of meet that balance, really.
There is definite need to balance the theoretical constructs that you gather from your research with things like engagement techniques and things like the user requirements and preferences. So, for example, some of the parents that I did focus groups with actually just wanted an app that said exactly, so they could type in what was in their fridge, and then it would come up with the recipes. Now, firstly, this was already on the market anyway, and secondly, how is this going to really make a difference with the target behaviour? So I think you have to kind of weigh up the pros and cons for taking on some of the user requirements, but some of them, such as we want glanceable displays, we want it to be mainly visual, then that was taken on. So I kind of had a criteria of what was most relevant to the target behaviour, and then what was easily implemented, and what's part of the user-centred design focus as well.
Yeah, I think it's a really good question, and I think the only thing I would add is that there's two issues that you need to somehow square in this. One is how effective something is going to be if people use it, and the other is, are people going to use it? And one of the things that's going to make a difference clearly to whether someone uses something is whether it makes any sense to them. So it's got to seem like that it's the kind of thing that would work. So finding a way of even if it may be the case, and it often will be the case, that you want to deliver an intervention function or a behaviour change technique because the evidence might suggest that it's the way to go, but people have no reason, it's not something that's on their radar. Even if you do that, if you can shape it in such a way that that it coincides with their mental model of what's going on, or help to educate them. So sometimes you may, with a behaviour change technique, need to add another behaviour change technique sort of into it in order to make it work. And I think that's one thing we'll probably talk about a bit later, is clusters of behaviour change techniques that work together. But I think at the end of the day, well, at the end of it, that's such a cliche. At any time of day, one needs to recognise that it's always going to be a judgment. Even if you think you've got the hardest, best randomised controlled trial evidence out there, when it comes to applying it in this context with these people in this situation, you're making a judgment, and there's just simply no way of getting away from it.
And I think the key thing is always just to be explicit about what you've done and the rationale for doing what you've done. And then other people can understand that, follow that, and build on that.
Alex Stratton from Lambeth and Southwark Public Health. Do you factor in things like duration and frequency? Because behaviour change takes time and practice, and people sometimes need some sort of hand-holding over it. And also, do you build in any kind of feedback that tells them how they're doing?
Okay, so this is duration and frequency of whatever the intervention might be, and we're talking about here anything from apps, which is actually totally user-driven, to where something might be delivered from a person to another person. I think all interventions ought to be designed with the audience or the users who are going to potentially benefit from it. And so it will so much depend on what the context is, what the population is, what the objectives are. So it's really important to think about those dimensions, but I don't think there's a one-size-fits-all. And I know people are, this is really more relevant to the next bit of the talk, but people are getting better about specifying the content of interventions in terms of what are the active ingredients. But the issues you raise, which is, okay, we're moving on from are those delivered or not, to first of all, what's the quality of what's delivered, and secondly, what's the dose, if one wants to use those terms. Really good questions, and we need to kind of really, these are questions for further research in a lot of ways.
I'm interested in the framework side of things, because obviously you've synthesised 19 frameworks, and I'm just wondering, some of us might be more familiar with those than this. Is it intended to supersede those frameworks, or is it intended to be used alongside? And if so, when do you bring in other frameworks that you might be more familiar with or not?
Okay, I think using frameworks compared to not using frameworks is a good thing for several reasons. It helps structure, it helps direct, it helps communication. The issue about which framework to use very much depends on your purpose. In terms of the behaviour change wheel framework, if you look at the original paper, you can do that by Googling behaviour change wheel, there's lots of electronic supplements, and one of them is all the steps we went through to synthesise those 19 frameworks. And so we're hoping that it's integrative and, as Robert said before, more comprehensive than any of the others. That being said, there may be particular reasons for choosing to use one or other of the frameworks. And it's really, I think, the same point I made to the previous question. I think so long as you have a rationale that you explain as to why you've done what you've done, then one's in the arena of science. And so I think that's the more important thing than, everybody using the same framework. I think you can tell from all the presentations that all of this is work in progress. Bringing together what we know into as usable a form as possible. And the book, which you will all be seeing later, is linked to a website. And do use the website, because on the website there will be updates, but also there's a portal for users and readers to send in comments, bring our attention to new other resources, etc. So it's very much designed to be a living, developing tool. And any profits that are made from it will go back into developing the website and new editions. So we have 10 minutes left. Can we start with a couple of people who were trying to ask questions earlier?
Thank you. That was really interesting. I work with different organisations, helping them to design behaviour change interventions, local authorities, social housing organisations, etc. Do you have any concerns that what you've developed might be perceived to be a bit too complex to be applied as often as you'd like it to?
First of all, we didn't have any particular perceptions about what we like. I think there's always a tension between trying to reflect the complexity of reality and the complexity of scientific understanding with making something usable. And so I think you'll never get it right all of the time for all of the people. What we've hoped is to get the best possible balance between being faithful to the evidence and the frameworks we're drawing on, and at the same time trying to put it in language that can be usable by anybody in whatever situation they're in. But as I say, and as I think Caroline said and Lou said, that this work is very much developed out of interactive workshops and discussions, and people like Christina using it and giving us feedback on early versions. And we're expecting and hoping that it'll be a continuing dialogue. So we'll find out from you and other colleagues the extent to which this is right and it can be adapted in the future.
Just in addition to that, I think that one of the things we try to do is to make it usable at any level of complexity, if you like. So even if the only thing you do is to look at the wheel as you're thinking about the intervention and think, I was going to do this because that's what, that's my sort of, what I thought would be a good idea. But since you mention it, actually, this may be relevant as well. So literally no more than 5 minutes sort of thinking to expand your horizons, all the way from that to a full-blown behavioural diagnosis. And I think the extent to which you go down the sort of more minimalist route or the really involved route will clearly depend on the resources and the time that you've got available to devote to it and how important it is to get it right. But even with that, the book is really, I think one of the metaphors that we use in the book actually is that it's really the opening moves in the game of chess. It's not the game of chess. In fact, it's a book on what the opening moves might be in a game of chess. you know, because the rest, you know, it doesn't in any way detract from or prevent or detract from the requirement for expertise. Because that's you know really where the sort of the crunch comes, is how much do you know, how much information have you got that you can apply.
I was just wondering if you had any guidance on how people can tell what the weighting and hierarchy of the elements in the COM-B system are when they're evaluating a given behaviour. I don't know if there's a scientific approach to it or if it's based on judgment, but it's something I've been wondering about.
The answer is that hopefully one day will be a more scientific approach, but what we've done in the book is to try to operationalise something which is what we have done in designing interventions, and that is to do a sort of, there's two little forms in there. One is a self-diagnosis, and the other is a sort of a diagnosis. And the idea is to take all the different subcomponents of what you think might be relevant and to get you to think in a structured way about, okay, is it physical, you know, let me think about, you know, is physical opportunity, or sorry, physical capability an issue here? Nah, probably not. And to apply, you know, any evidence that you might be able to bring to bear on it. So just basically going through what we call a COM-B evaluation questionnaire. So there is a questionnaire in there, and there's even a self-questionnaire, a self-evaluation questionnaire, which would only work to the extent that whoever's being self-evaluated had any insight. And you may do both and see to what extent they differ from each other.
To add a point, so I think it's really important to use more than one set of data. So to give an example, we've got Siri Simon and Chris Fuller here who are doing work to understand why health professionals aren't delivering guidance evidence-based guidance on implementing the Sepsis 6 steps and using this approach, and drawing on 4 different sets of data. So one is interviews with key stakeholders, another is focus groups, a third is looking at the documentation, and the fourth is observation and using fieldwork notes to draw on those and put them all together. So I think, you know, what's got a triangulation of what, I think it's important in coming to the best judgment about each of those, drawing on more than one source of data.
I'm in a slightly different field that I'm looking at financial decision making and how you can change behaviour in investment managers. You mentioned at the beginning that you're in a cross-disciplinary, taking a cross-disciplinary approach. And I'm just interested when you talk about tutors in your training system and generally how to interact with you to find somebody in the right discipline that might be able to help. I mean, there's a lot of analogies to draw from the health field, but how else could we draw on the cross-disciplinary nature of it?
Okay. So the tutors in terms of behaviour change techniques is quite a specific thing and not being yet set up. But in terms of accessing the range of disciplines at UCL, we've only been going since February, but one of the things we've done is set up a database. I think we've had 40 responses so far from people at UCL outlining what their disciplinary backgrounds are, what their areas of expertise are, so that we're in a position when people approach us to say we would like expertise in the following area, we'll be able to then put them in touch with relevant people at UCL. And the events that we're putting on, as much as possible, are drawing in people from different disciplines. So whether it's public policy, economics, we've got law represented here, the built environment, IT, etc. Yeah, and also I should say on a more general point, if people do have topics or suggestions of events they'd like us to put on, or disciplines they'd like us to bring together to address any particular topics, do get in touch. There's an email address on the website.
Thank you. I just wondered how the taxonomy relates to the international statistical taxonomies, classifications, such as the WHO choice suite of interventions and the international classification of health interventions.
We've been in touch with the WHO people, but it's when we find out about the work they're doing to let them know about our work. At present, there is no direct links, and what we've become aware of is there's lots of different bits of work that are being done that are relevant and need to be linked up. And one of the next steps we have for this work is we did have an international advisory group of 30 people, but is to get funding to set up an international consortia to really strengthen the interrelationships between these different pieces of work. So the National Institute of Health in the States are willing to cooperate with us to begin that work. But do email in any contacts or specific suggestions on that.
I'm just wondering if there's an issue of scale and how that may relate to the model that you have in your book. If it's easier to reach 1,000 people, or is it equally applicable to reach millions of people?
I think it'll depend very much on the specific behaviour concern, but scale is clearly a very important issue. So there's a traditional, and you see it a lot, distinction made between individual level and population level interventions. One of the problems with this, if you've ever tried to apply that rigorously, is it's a bit like pulling at the thread coming out of a jumper. It actually sort of disappears because, for example, something that you might think of as the ultimate individual level intervention, which might be counselling for or behavioural support for smoking cessation, is currently being delivered to 800,000 people in this country every year. So is it a population level intervention or is it within individual intervention? But what's going to really make the difference is the extent to which the way, the sort of policy category, if you like, is delivered. So a mass media campaign can be delivered in a particular way, whereas a service provision has to be delivered in a different way. So I think that the scalability of an intervention is much more to do with things, with the specifics of the content and your target group, than it is to do with the intervention functions or policy categories. But it's clearly something that one needs to have be very cognizant of right from the beginning. Right at the beginning, you have to be thinking, am I talking about intervening to change the behaviour of 10 people, 1 person, 1,000 people? And if so, how do I find them? And how do I engage with them? And the other thing I should have mentioned earlier is that although we've presented this as sort of arrows going from left to right, of course the reality is that you'll be going backwards and forwards and you'll have ideas and things that you'll try out, actually that's not going to work, and therefore you have to go back and rethink, and that's inevitable in the process.
That new technologies really provide big new opportunities for reach, but then there's problems about engagement. So people are beginning to look at what are the best combination of using new technologies to get scale and get reach with human beings to really try and get engagement. And I think it's a really rich area for research. And one of the things we're hoping to do either in the autumn or spring is have a conference on behaviour change and new technologies to address this. So that's another whole angle in there. We've got time for one more, if there is one more, before repairing. No? Okay. Well, can I thank the speakers, thank all of you, and look forward to hopefully coming and joining us for a drink and talking to all the speakers and each other. Thank you very much.